So the two of us graduated from Emory University School of Medicine in Atlanta, Georgia. And then you went on and did your residency in family practice?
Yep, and back in Virginia.
Uh-huh.
And
But prior to med school, what did you do?
so I went to seminary and went to Yale Divinity School and became a United Methodist minister. And then the way I think about myself is I am a pastor who acquired a particular skill, which was to be a doctor.
So you're first a pastor, aren't you? Isn't that interesting?
That is definitely how I see myself, yeah.
Yeah. And so you went to what drew you to Memphis?
So it's hard to believe, but I had, over the years, introduced myself to a number of different people who were linking the concept of faith and health. One day I was in the chaplain's office at the Yale Medical School. I looked on his desk and there was a little pamphlet that said how to start a church-based health clinic. And I go, that's it, that's what I want to do. And then as I finished my education, I wanted to stay in the South. I didn't want to go back to Atlanta. And then, not making this up, I read somewhere that Memphis was the poorest major city in America. And based on that, I said, I'm going to Memphis. I did not know a single person there, but that's where I went, and I've been for 30 years.
And you've established what's happening in Memphis for you?
Yeah, so I went in 1987, started something that at that point was known as the Church Health Center, now known just as Church Health. And what we do is provide health care for people who work in low-wage jobs who don't have health insurance. We do it in the name of the faith community. So we do this without government support.
Money.
And we currently care for over 70,000 people. So the largest faith-based, privately funded health center in America.
Now, if they have insurance or if they have money or they want to pay, you let them pay a certain amount.
Yeah, we're not a free clinic. I don't believe in free clinics. Poor people aren't looking for a handout. They're looking for something they can afford. So we charge people according to their income. People give us verification of their income, and we charge on a sliding scale. Now, most people pay about $20 for a visit. We are 100% focused on the working uninsured and people who are working to make our lives comfortable, that they cook your food, they take care of your children, your grandchildren, they wash your dishes, they cut your grass, they one day dig your grave. In Memphis, where we have not expanded Medicaid, none of these people are going to qualify for anything. Their job doesn't offer them health insurance. They don't qualify for Medicaid. There is no such thing as Obamacare.
They're
on their own. They're absolutely
working for, aren't they?
Right. So we have 12 physicians who this is our job. We have a couple of nurse practitioners. The amazing thing is we have 1,000 doctors who volunteer with us, which is a huge thing.
Throughout Memphis?
Throughout Memphis, across the board. One of the coolest things is what I call my retired doctor phenomena. We have 62 subspecialist physicians who have retired. They go play golf for 6 months. Then their wife calls me and says, can't you do something with him?
This guy?
And we have now put them to work, and we have built them a playground. And the only way you get to see these doctors who 5 years ago were thought of as the best doctors in Memphis is at our facility.
One of the problems that I see in American healthcare is that we have not given enough attention toward mental health care. Any comments about mental health?
Yes, so I'm a primary care doctor. 50% of people who come to primary care doctors have no medical problem. People come to the doctor today for reasons they used to come to the priest. So the doctor giving you an extra 15 minutes of his or her great wisdom is not going to solve any problem. And the pills rarely work. So behavioral health is a huge issue. The issue of substance abuse is over the pale. And then what we really worry about is dual diagnosis, both the substance abuse and depression. And so which comes first, the depression or the drinking? It is really hard to figure that out. And it cannot be driven just by the physician. So we have behavioral health specialists on our team. We have health coaches. We think issues of diet and nutrition play into behavioral health. So we have a full spectrum of services at the Church Health Center.
Wow.
It is a powerful thing to feel called into this type of work. We have 1,000 doctors who volunteer with us, but we have many thousands others who volunteer in one other way. What I believe in my heart of hearts is by being engaged with us, either as a volunteer or as a donor. I mean, we have to raise over $20 million of real money every year to do this work. It will make your life better. It will drive you personally closer to God. Now, you want to be closer to God, then you ought to be involved in the work we do, because this is what God has called us all to do. Church Health in Memphis is the home of an idea known as parish nursing or faith community nursing. We actually today call it the Westberg Institute. This idea has been around for almost 40 years now, started by a guy named Granger Westberg, who was a Lutheran pastor in Chicago, who asked the question, wouldn't congregations create a healthier life for people by actually having nurses work in a church? It's actually a brilliant idea. Clergy are not very good at dealing with healthcare issues. Why not have a nurse as your partner? Now, this is not about checking blood pressure on Sunday morning. This is about helping people live into what the life well lived would look like. So there are actually 18,000 nurses around the world who are trained in this type of work. They've all been trained through a curriculum that we in Memphis control and have designed. They are so passionate about their work, and I've come to realize there are some truly amazing nurses here in South Dakota who care deeply about this, and everybody listening is probably just a phone call away from a parish nurse. Strictly from a Christian standpoint, a third of the New Testament has to do with healing the sick. But whether you're Jewish, Muslim, Hindu, it doesn't matter. Every major faith community, for the most part, takes the same point of view.
Yes.
We have an obligation to provide health care for the poor. So what are we doing about it? I mean, historically, we used to build hospitals that have church names on them. If you want to follow Jesus, you want to be connected to God, the call to discipleship is to do three things: to preach, teach, and heal. You don't get to take a pass on the healing part. Do you really want to look Jesus in the face at the end of time and have him say to you, do you think I was kidding? Did you think I didn't really mean that part of it? I personally don't want to do that, and what I think is that if somebody is building my house and they fall off the roof and they break their leg and they're uninsured, we have some obligation to take care of them.